This is my first baby. We delivered at Doylestown Hospital on Wednesday, January 20th. The day that I went into labor, my water broke here naturally, and I wasn't sure if it was my water. I kind of second-guessed myself being a first-time mom.
Victoria is a patient of mine who I had the pleasure of seeing at her first prenatal visit, and it was so exciting. I really enjoy meeting these patients at the very first visit. I fell in love with obstetrics during a pre-medical school externship in the summer when I was in college, and it was the first time I was able to see a delivery, and it just blew me away.
I was really nervous. I wanted to do a natural labor, and when I had corresponded with Dr. Ianeri before I went in, she had actually said to me, "What are you looking for as far as your labor?" And she said, "I'll support you either way." When I went into the hospital, my contractions, I couldn't talk through my contractions. I was like right there. And Dr. Ianeri came about 20 minutes later. The nurses were wonderful there.
I was fortunate enough that one night when I was on call, she came in and was in labor, and I was able to be here to support her.
Everything went really smoothly. I was really nervous to be in a lot of pain. That was a huge concern of mine.
The nice thing for me is that I never have trouble getting up in the middle of the night to come in for a delivery because it's so exciting. I think that's one of the best things to wake up to, and when you love coming to work, it doesn't matter if it's 2 o'clock in the morning or it's 2 o'clock in the afternoon. We try to provide the best medical care possible in a safe and compassionate environment. We feel strongly that it's important to educate our patients and to really guide them so they have the best outcomes for their pregnancies.
Everybody was really nice, and I'm a nurse too, so I kind of take special look for, bedside manner. And
both Victoria and her husband are both nurses, and they work outside of our health system. And the fact that they felt so strongly that they wanted to deliver here really means a lot.
And again, it was the support. It wasn't just like, let me take your vitals, let me check you. It was, talking about the birth experience, talking about, do you want an epidural, trying to make me as comfortable as possible.
We have an affiliation with CHOP, so there's in-house neonatologists 24 hours a day.
Knowing that you have job physicians is huge. That's you take pride in that, and you can't measure that care. There's a lot of great things about my whole experience, but what really comes down to is the doctors. They care about you. The nurses care about you too. I never once felt like one of my questions were stupid. I never felt like I was rushed by any of the physicians. When I called, when I was there for an appointment, I always felt like I was focused on.
To be able to be there for that delivery and hand over that baby and see the joy and the love on their faces is just the most incredible thing to me, and that's really what I love about this job. Is just, it's an awesome experience. It's a privilege.